Ischemic heart disease, important for us to take a look at the following table. Quite. So, the patient has now moved on from unstable angina, unfortunately, has now experienced a myocardial infarction, an MI. So, how do you know that? Patient says, I have chest pain, has tachycardia, has diaphoresis. This chest pain is radiating where? Up into the left shoulder, is maybe moving up into the jaw. Substernal chest pain, isn't that right? Take a look at the cardiac enzymes, you find troponin I to be elevated. Why is that your gold standard? Because within 24 hours, it is elevated. And how long does it last, troponin I? About 1 week. Keep it simple, okay? So therefore, it's quite difficult for you to miss your patient having a myocardial infarction with troponin I. And you shall see that in a second. So now what we're doing here, and the important points of changes of myocardial infarction, 0 to 24 days, 0 to 24 hours, gross changes, light microscopy, and then complications. 0 to 24 hours. We have occlusion of an artery, infarct. You have dark modeling, is what you're looking at, and pale with the area. Pale, because it just underwent what? Necrosis. What kind, please? From basic pathology, it's a coagulative necrosis. What kind of infarct is this? A pale or hemorrhagic infarct. It's a pale infarct. Things that we have already referred to. So, let's begin at the top. Coagular necrosis. What then happened? There was reversible injury at first, wasn't there? There was ischemia taking place, lack of oxygen. If there's no oxygen, then what kind of glycolysis do you have? Lack of oxygen, anaerobic glycolysis. Are you going to produce as much? Pyruvate? No. You're going to produce more lactic acid? Sure, you will. Anaerobic glycolysis. Lactic acid in that area. What happens to your pH? It decreases, right? So what happens to your enzymes? Enzymes in an environment where it's acidic. Is it more active or less active? Do not memorize this. What kind of necrosis? Coagulative necrosis, right? And what's coagulative mean? Preservation of your architecture. How is it that your preservation of your architecture? The enzymes aren't working. Is that clear? Gross changes. Pale. Why is it a pale type of necrosis or pale type of infarct? Because there's only one blood supply to that particular tissue or organ. Light microscopy. Early coagular necrosis, preservation of your architecture. Wavy fibers. So what you're seeing here in this schematic is cardiomyocytes, and they should be nice and parallel normally. Do you remember this from histology? You've seen this before. And the cardiomyocytes should be nice and parallel, should be nice and straight, and they should have intercalated discs. Remember? And those intercalated discs are your gap junctions so that your heart then beats as one unit called syncytium. Okay? So what then happens here early on, 0 to 24 hours, you might get wavy fibers. You see that? It's wavy. Shouldn't be like that. Early changes. Next, this is an acute MI, so any type of acute inflammatory response, what are you going to bring in? Neutrophils. Good. Neutrophils. Next. Now, things that we'll talk about later is that, remember, management, what are you trying to do? You're trying to bust that clot. And if you want to bust that clot, what might introduce? Reperfusion injury. And we'll talk about this later. And when there is reperfusion injury, you might then introduce tons of calcium. You see that? Tons of calcium coming in and therefore causing quite a bit of damage, as we shall see. Complications. Well, we have ventricular arrhythmias, maybe heart failure. Worst case scenario, when you have arrhythmia, what may then happen? The heart might just stop. Cardiac arrest. Welcome to cardiogenic shock. Let's continue. 1 to 3 days. If it's 1 to 3 days, now what happens to this necrosis? It is rather extensive. Now you have lots of neutrophils coming in, and now, after 3 days, what kind of pericarditis might this be? This is 3 days, so therefore this is fibrinous pericarditis versus what other type of pericarditis might you see, please, in pathology? Dressler's, right? Dressler's pericarditis. And as we go through cardiology, we'll take a look at the difference in timeline between fibrinous pericarditis, which would be days, versus Dressler, which could be 3 weeks to a month, or perhaps even a little bit more, but not within 3 days. It is that clear. That must be understood. And if your patient does have pericarditis, then what happens? You lean forward. I feel so much better. You lean back. Oh my goodness gracious, you're creating friction, pericarditis. And you do inspiration. That makes it worse, doesn't it? Welcome to pericarditis in general. Things that you guys know, but just to make sure that we put things into context. Let's go to 3 to 14 days. So now we're beyond 3 days. We're getting into weeks. So now the neutrophils are going to be replaced by whom? macrophages, and take a look at the cartoon there. That is hyperemic. What does that mean? That means that after 3 days, that the heart and the tissue is trying to recover. Now, necrosis is irreversible, but what about the surrounding tissue? Well, you can have a rim of hyperemia. Is that clear? That is within 2 weeks. Rim of hyperemia. Now, that is the most important point there. Macrophages are coming in. Now, let's go into complications. Now, with this, I'm going to walk you through this as well. So now, when you think about repair process, close your eyes, think about repair process, okay? Now, you think about the repair process, then should you be bringing in collagen? Sure. What lays down that collagen? What's the name of that cell? Come on. Good. Fibroblasts. And you're going to have a scar. Good. And is a scar always a good thing? Not in the heart, huh? Say that you have a scar formation taking place in the heart. What happens to the conduction system? That could be affected. Welcome to arrhythmia. Next, what if you had fibrosis and that scar wasn't strong? What then happens? I want you to think about the ventricle. And let's say that the ventricular wall with the scar is quite weak. Are you with me? So with all that pressure, what's going to happen? A ventricular aneurysm, right? With that aneurysm, what does that mean? Ballooning. At some point, what may then happen to the wall? Whoop, it might give way. What's that called? Rupture. Okay, now let me ask you something. When you have rupture taking place, how quickly is that fluid building up in the pericardium? Once again, you walk me through this. How quickly is that fluid accumulating in the pericardial cavity? Like that. Like that. I don't care if it's even a measly 200 milliliters. A little amount of fluid rapidly accumulating in the pericardial cavity, by definition, is what? Good. Pericardial tamponade. Are you seeing this? Are you seeing this? Good. Let's continue. There might be papillary muscle rupture. At some point, when your heart starts dying, then what happens to the mitral root or even the aortic root? It might then become expanded. Welcome to what, please? Valvular heart disease. What kind? If you have root dilation, don't memorize this. Root dilation, what's that going to give you? Regurgitation type of valvular heart disease, isn't it? Let's continue. Now, next, you have what's known as your pseudoaneurysm, and you're worried about there once again. Rupture is what we're talked about. It's macrophage-mediated structural degradation. Okay, so all of these things at some point in time may give you serious complications. Let's go into weeks now. With weeks, we have scar formation. We have lots of collagen and such, and you're paying attention to Dressler syndrome. So what's the difference between fibrinous and Dressler? They're both pericarditis. Fibrinous pericarditis would be the normal type of inflammatory process that you might see within 3 days. However, if you have an autoimmune response for whatever reason, and you might then result in pericarditis weeks to months later, then you're thinking about Dressler. It is that simple, and it is that clear. These are some of the most important changes that you want to pay attention to when you're dealing with myocardial infarction in terms of hours, days, weeks, and months. You pay attention to these tables, you're in fantastic shape.